The COVID-19 pandemic demonstrated to health professionals around the world the importance of effective communication with the public and having a plan in place. For this reason, the United States Centers for Disease Control and Prevention is training health professionals in Tobago on surveillance of vaccine-preventable diseases and crisis and risk communication. This training is being facilitated in part by the Ministry of Health. More in this report from Candice Jackson.
As travel around the world becomes easier and more accessible, the transfer of diseases from one country to another also becomes more likely, according to Dr. Benjamin Dahl, supervisory epidemiologist with the U.S. Centers for Disease Control and Prevention.
And we've seen that a disease could happen in the United States and be here in 3 hours. A disease could happen in Tobago and be in China in 10 hours.
This was certainly evident during the COVID-19 pandemic, which led to global lockdowns for several months. It is one of the reasons why the U.S. CDC is working with the Ministry of Health to train health professionals across the country, including in Tobago, according to Dr. Patrice Rabatali Nandram, Senior Public Health Specialist.
It's critical that this beautiful sister isle also have the persons who have the correct knowledge to approach outbreaks and be involved in rapid response. They should be as knowledgeable about vaccine-preventable diseases, just like their colleagues in Trinidad.
The workshop was welcomed by the Secretary of Health, Wellness and Social Protection, Dr. Faith V. Israel.
So this training is being held because we need to ensure that whenever we are treating with diseases that are vaccine-preventable, that we get it right from the beginning to the end. So it includes, for example, quite a bit of surveillance and doing the background work so that if anyone pops up with a disease, we are alerted that that disease is on the island in the first instance.
Dr. B. Israel also endorsed the training in crisis and risk communication.
So day one specifically talks about crisis communication, which is instead of, running, oh, the sky is falling, we would be able to say to the people of Tobago in a coherent way that does not scare them, but provides the necessary information. Say, okay, this is a situation, this is what we are doing, this is what we need you to do, and together we would be able to withstand or we would be able to control whatever the disease that we are treating with.
Currently, the world is paying attention to the monkeypox epidemic in Africa, and Dr. Dahl noted that the workshop will include specific focus on that disease. However, he pointed out that the risk of it spreading to the Caribbean is low.
I think the Ministry of Health is well equipped to deal with any potential cases, but I think the risk here is low, but that's why we do disease surveillance, so that one could detect any potential cases. And I really feel that the ministry is prepared.
Candice Jackson, Tobago Updates, Television News.